It's a story that's all too familiar to First Nations families, and their experiences are now backed up by a new joint study. It found they had far more contact with the child welfare system than non-First Nations families. The study was done by the Assembly of Manitoba Chiefs and researchers at the University of Manitoba. The study shows 50% of First Nations birthing parents had an open CFS file, 4 times higher than non-First Nations parents. 27% had one or more of their children removed by CFS, 6 times higher than non-First Nations parents. And 9% of all First Nations birthing parents experienced a termination of parental rights of one or more of their children. That's 5 times higher than non-First Nations parents. Kathleen Kenny in the U of M's Department of Community Health Sciences says this is disruptive.
I think the underlying message is that First Nations families need to be protected and supported to flourish.
AMC Grand Chief Kyra Wilson says the data is relevant to families today, even though the study is from 1998 to 2019. That was before birth alerts ended, a practice that flagged mothers considered high risk before they gave birth. The Grand Chief says more First Nations should be given jurisdiction over the system, but they need help from the province.
We need to make sure that we have capacity within our nations to ensure that children don't fall through the cracks through any transitional period. We need to make sure that our communities are supported in that way.
Families Minister Nahanni Fontaine called the report important. The minister says keeping families together and decolonizing the child welfare system is her #1 priority.
We're leaning into jurisdiction, so transferring child welfare to First Nation communities where it rightfully belongs.
Fontaine says CFS agencies can now place children with extended family or in their communities. It means parents can retain guardianship and get additional support.